Hello everyone, my name is Crystal Folks, and today my presentation for you is on systemic lupus erythematosus. Within my presentation, I will be discussing with you what is systemic lupus erythematosus, the causes, some symptoms, non-systemic forms of lupus, diagnosis, treatment and lifestyle changes, prognosis, facts, and some research. Systemic lupus erythematosus is referred to as SLE or lupus. It is a chronic long-term disease that causes systemic inflammation which affects multiple organs. It can affect the skin, joints, kidneys, brain, and other organs. The causes of SLE are unknown, but are believed to be linked to environmental, genetic, and hormonal factors. Sometimes even the medications that you are prescribed by your physician may lead to you being diagnosed with lupus. There are a variety of symptoms for systemic lupus erythematosus. You can see them listed on the infographic to the right. One of the many silent illnesses that come along with lupus is cystic fibrosis. Cystic fibrosis is a disease where patients have an increased level of mucus in their vital organs. This primarily affects the lungs and pancreas and can be severely life-threatening. Cystic fibrosis leaves patients susceptible to serious and sometimes fatal lung infections, and their pancreas is unable to produce enzymes needed to extract nutrients from their food. There are three non-systemic forms of lupus. These three forms are cutaneous lupus, drug-induced lupus, and neonatal lupus. The first is cutaneous lupus. Cutaneous lupus only affects the skin of the individual. The second form is drug-induced lupus, which is caused by high intake of certain medications, but this form will usually subside with the discontinuance of the medication. Lastly, there is neonatal lupus, which is a very rare condition that is caused by the mother's antibodies affecting the fetus. The symptoms of neonatal lupus usually disappear after 6 months without any lasting effects to the fetus. There are many tests that are used to diagnose lupus. Some of the main ones consist of anti-nuclear antibody, or ANA, CBC with differential, chest X-ray, serum creatinine, and urinalysis. Some other tests that may be done consist of kidney function blood tests, liver function blood tests, imaging tests of the heart, brain, lungs, joints, muscles, or intestines, and also antibodies to double-stranded DNA. First off, there is no cure for lupus, but treatments can help you feel better and improve your symptoms. Systemic lupus erythematosus treatment consists primarily of immunosuppressive drugs that inhibit activity of the immune system. Hydroxychloroquine and prednisone are often used to treat systemic lupus erythematosus. Other medicines prescribed and treatments consist of nonsteroidal anti-inflammatory drugs such as ibuprofen, antimalarial drugs such as Plaquenil, chemotherapy, and other medication for whichever other illnesses are triggered by the lupus. A few lifestyle changes, such as wearing protective clothing and sunscreen when out in the sun, staying up to date with all of your medical needs, especially immunizations, avoid consuming tobacco products and limit alcohol intake, make healthy choices with the food that is consumed, remember to take all medications as prescribed, and trying to adopt a healthier and active lifestyle can help prolong your life. Individuals with systemic lupus erythematosus can live a long and healthy life with the illness if they actively work towards attaining good health. Did you know lupus is an autoimmune disease? Systemic lupus accounts for approximately 70% of all cases of lupus. Lupus affects 9 times more women than men. Many women with SLE can get pregnant and deliver a healthy baby. Lupus is approximately 4 times more common in Afro-Caribbeans than in Western Caucasians. In 2018, a new study by Dr. Keith Elkin of the University of Washington and his colleagues have created a new drug named X6, which they claim is more effective and safer than the old hydroxychloroquine. that is usually prescribed to lupus patients. The formula has yet to be used for human patients in their study, but it has been effective for the mice in their program. Tests will need to be performed with the mice and human cells before an actual human will be involved with the new drug study of the X6 drug. Thank you for taking the time to listen to my presentation. Hopefully I have offered new knowledge to your studies.